What is the most probable diagnosis for a boy who was born spontaneously, without any complications, at 37 weeks of gestation, and whose mother was prenatally tested negative for antibody group by streptococci, rapid plasma rhein, hepatitis B surface antigen, gonorrhea, and chlamydia, but is now showing symptoms such as cyanosis, harsh holosystolic murmur loudest at the left lower sternal border, and palpable non-bounding peripheral pulses bilaterally. He is breathing at a rate of 60 min with a heart rate of 130 min. By coarctation of the aorta B transposition of the great arteries C patent ductus arteriosus D tetralogy of Falloti truncus arteriosus. Pause the video and think about the diagnosis. The correct answer to the question is B. The most common cause of cyanotic heart disease in neonates is transposition of the great arteries TGA, which accounts for 5% of congenital heart defects. This defect results in parallel pulmonary and systemic circuits, leading to recirculation of deoxygenated blood through the body and oxygenated blood through the lungs. Mixing of the two circulations is required for survival and is achieved through an atrial or ventricular septal defect or patent ductus arteriosus. TGA typically presents at birth with cyanosis and tachypnea. The egg-shaped silhouette egg-on-side/egg-on string seen on plain film radiographs is due to the absent main pulmonary artery stem and small heart base. The murmur in this case is caused by the ventricular septal defect VSD that mehays oxygenated and deoxygenated blood, which is necessary for some oxygen-carrying blood to reach the aorta rising from the right ventricle. Prostaglandin E1 is used to keep the patent ductus arteriosus open, and a balloon atrial septostomy can be used if necessary. An arterial switch surgical procedure is used to repair the defect. Answer is not correct. Coarctation of the aorta is a type of a cyanotic heart disease that occurs in approximately 8% of congenital heart defects, with a higher prevalence among males than females. 2. Although more common in male, it is frequently associated with the infamous Turner syndrome 45X. In 80% of cases, coarctation of the aorta is associated with a bicuspid aortic valve. Infants with this condition may develop congestive heart failure, which is characterized by a systolic ejection murmur that is audible at the left upper sternal border and radiates to the interscapular region. Physical examination typically reveals weak and delayed femoral pulses compared to the upper extremity pulses, as well as hypertension in the upper extremities. On chest X-ray, a reverse 3 sign may be observed due to constriction of the aorta at the coarctation and dilation of the aorta pre- and post-coarctation. Additionally, notching of the ribs may be visible due to collateral circulation through the intercostal arteries and erosion of the ribs by the collaterals. Treatment for coarctation of the aorta involves either angioplasty or surgery. Answer choice C is not the correct option. Patent ductus arteriosus PDA is a type of a cyanotic congenital heart disease. PDAs represent 10% of all congenital heart defects and are more common in preterm infants, with a higher incidence in females. Large PDAs can cause symptoms such as congestive heart failure, recurrent respiratory infections, and failure to thrive. However, small PDAs may be asymptomatic. Physical examination may reveal a continuous machinery murmur heard best at the left upper sternal border, bounding peripheral pulses, a prominent apical impulse, and a thrill. X-ray imaging may show cardiomegaly and increased pulmonary vascular markings. Typically, PDAs will close on their own within the first month of life. If necessary, surgical ligation or coil embolization can be performed. Indomethacin may also be used to promote PDA closure in preterm infants. Answer D is incorrect. Tetralogy of Fallot TOF is a cyanotic heart disease that usually presents in infancy and is the third most common cause of this condition in neonates, after TGA and hypoplastic left heart syndrome. It consists of 4 defects: right ventricular outflow tract obstruction, VSD, right ventricular hypertrophy, and an overriding aorta. Infants with TOF may experience cyanotic spells and agitation, which can lead to hypoxia, metabolic acidosis, and death. These spells may resolve spontaneously or require medical intervention. On physical examination, infants with TOF typically have a normal S1, single S2, and a harsh systolic crescendo-decrescendo ejection murmur due to right ventricular outflow tract obstruction that is loudest over the left upper sternal border and radiates to the back. They may also exhibit a boot-shaped heart on X-ray of the chest and increased pulmonary vascular markings. TOF is corrected through surgical intervention. Answer E is incorrect. Truncosarteriosis is a rare form of congenital heart disease that can lead to both cyanotic and congestive heart failure. It is characterized by a single arterial trunk arising from the ventricles and branching into the pulmonary arteries, distal to the coronary arteries, and proximal to the first brachiocephalic branch of the aortic arch. A ventricular septal defect, VSD, is always present, allowing for the complete mixing of pulmonary and systemic blood, and resulting in identical oxygen saturation levels in the pulmonary arteries and aorta. In 30% of cases, there is also a right-sided aortic arch. On physical examination, a harsh holosystolic murmur can be heard at the left lower sternal border due to the VSD, and there is a prominent single S2. Arterial pulses are strong and bounding with a widened pulse pressure. Cardiomegaly and increased pulmonary vascular markings are visible on chest X-rays. Initial management may involve the use of medications such as digoxin and diuretics, followed by surgical repair of the defect.